Thank you. Thank you so much. I planned for 5, so I guess I'll just take my time. But good evening, everybody. It's a pleasure to be back here. Last year was home in Montreal, and Ohio holds a special place in my heart because since last year's Shark Tank, our lead U.S. investor is based here in Ohio that I'll chat a bit about soon. So I spend quite a bit of time here. But just to level set a little bit for those who were not here last year, I just thought I would start off with the problem that we're solving. So all of us are consumers outside of our healthcare involvement, either as surgeons or others in the ecosystem. And we all know that in every other industry, in retail and everywhere else, we have more and more technology in terms of AI and vision so that we know what comes in, what goes out. And so we're able to manage our supply chain in a way that not just manages costs, but also manages the environment and allows us to reduce waste. And many of you guys may remember from last year that about 70, and also from this morning's innovation session, about 70% of the carbon and sustainability issue in healthcare relates to scope 3 on the supply chain. And so what is really the impact from a business perspective when we don't know what comes in and what goes out? There's higher costs, there's environmental waste, but there's also missed revenue. And there's a lot of wasted time for valuable clinical staff. So we're actually solving a multitude of problems at the same time. A little bit of background on our company. So we developed our technology inside of the largest hospital in Montreal. We then had the privilege to expand with the next largest academic medical center, McGill, to be able to stress test our technology and make sure it worked. And when I came here last year, we were really just getting ready to embark on our first U.S. Opportunity to pilot and validate that our technology would be repeatable in the U.S. market. And this year has been all around how we set up for our U.S. go-to market for more scale, while we've continued to actually commercialize every relationship that we started with in Canada. And so my claim to fame that I'm able to share with prospective customers and also investors is that we've never been kicked out. At times, we've made strategic decisions to, take a moment and go elsewhere because of certain factors, but we've achieved success in virtually every single one of our few implementations so far. So for those who didn't see again last year, the basic product, again, is just using standard off-the-shelf hardware. This is an iPad on a stand. The image-based recognition functions off of the camera, where in under a second, we can detect exactly what's used. We have a cloud, basically secondary layer of our image processing to make sure that we never slow things down. And then we have an automated process with a human in the loop so that we're constantly able to recognize new products, substitutes, trunk stock, et cetera. And we consistently achieve 98% or higher recognition rates, while also tracking waste to be able to have accurate, measurable data on what we use. So in a nutshell, in terms of our AI capture solution, which is really the foundation, we are moving away from the friction of barcodes, which require first of all, the package should have a barcode. Second of all, your ERP now needs to be updated, or RFID solutions, which have wonderful value for assets like medical equipment, but which are expensive and not necessarily scalable across the health system. And so our vision is broader in terms of being able to impact not just surgery and high-cost procedures, but that has been our go-to market, where we started off in the OR, and more recently, actually, with the help of Shark Tank, among other things that we've been able to accomplish, also started looking at some other high-cost procedural areas, in particular the cath lab, EP, and IR. Have been great areas of interest. And some of the feedback that we received from the last year is that it's not just the capture that is fundamentally different from the existing solutions, it's actually the granularity of the insights and analytics that we can provide. And so in today's world, how do you compare a lobectomy and make sure that you're really comparing apples to apples when there are various different techniques or any other surgery. That's the level of granularity that our analytics come from, and I'll touch a bit more on our insights when I get into some of the specific progress that we were able to make over the last year. So at a high level, what we were able to do with the prize money is just have a lot more conversations. So I've been on a lot of planes along with my team over the last year because we've conducted about 12.5 deep dive discovery visits with U.S. health systems all over the country to really understand their pain points, what they liked about our product, what they also needed to see in our product to be able to accomplish it. And so we had broad scale market feedback whenever we have basically had the opportunity in the U.S. market, and it still has been limited to date, and I'll talk a bit more about our future plans. What we've been able to achieve with our U.S. implementations is that we are reducing any of the friction and burden from the administrative and clinical teams. That includes not just the circulating nurse or techs, but also the actual perioperative team behind them that is constantly struggling with inaccurate data, and then also extending out to the supply chain teams that also struggle with having inaccurate data. So a huge amount of, I would say, overall satisfaction by multiple players within the health system. We've been able to show cost savings up to 25%. And I think the claim to fame is really around the capture recognition rate, 98% and above. And one of the biggest learnings for us across our discovery has been that recognition rate actually has a direct top line impact. Because we're Canadian, or at least I'm Canadian, and most of our team that kicked off started off in Canada, we really did not understand the difference and actually the additional layer of value that we offer in the U.S. market, where there is constant mischarges because we are not actually capturing properly what we use. And so that top line benefit has been a big learning for us over the last year in terms of our overall value proposition. So in terms of just the very specific progress, I figured I would try to get pretty measurable beyond our 98% recognition. In Canada, we've been able to double our footprint in terms of the number of procedures and specialties that we've covered. Very proud to share that our living lab, where we started with one procedure, then one specialty, then expanded to 6, is proceeding with a full-scale, fully integrated solution across the hospitals, across 39 operating rooms, and we're also an expansion in the other locations in Canada as well. We've been able to optimize and validate workflows. I know that doesn't sound super exciting, but those of you who are surgeons, and I think a few of the sharks mentioned it before, like everyone works very, very hard to perfect their workflows. And we had to make sure that our workflow was super flexible, but also really worked for a majority of situations. The I would say most important commercial tangible progress point that I'm excited to share is that we had aligned with our investors to make sure that we had really just a handful of U.S. partners where we could go deep, learn together, but actually shift our strategy from pilot to initial commercial agreements. And so we've identified and basically maxed out with all of those partners. Some are in contracting stages right now. So our last year has been, I would say, less about U.S. deep implementation, but over the last year, like we've landed some pretty exciting thought leaders, and so beyond actually just landing the partners, I'm just pretty proud and excited about who we are partnering with. And I wish I could share their logos because I think there would be a lot of recognition, but we're just not at that stage yet. And then I think we understand what we need to build. Like our product roadmap has been significantly refined through these discovery processes with the team. Last year during the judges panel, I remember, I think it was Scott who asked, like, when are you guys going to make sure that you can actually capture product without any human intervention whatsoever? So when can you just have a camera watching? When can you have that reliable visual recognition in a much more passive, automated way? So excited to share that one of the ways, again, that Shark Tank helped us is we have a prototype now. It's live at the CHUM Hospital. We're testing a variety of use cases. One of the use cases that came up a a lot was the prep table in the OR. Another use case was the returns bin, all the products that are returned at the end of the case. And probably the third most common use case that we've been planning for is the picking process. So Dr. Schweitzberg, when you're surprised, when you're expecting something to be in the room and the patient's on the table and you don't have that something, we're going to be able to catch it like 24 to 48 hours ahead of time. And so we have not brought this to market commercially yet, but in parallel to our commercial journey, we've been building this out and actually have some exciting partners that we're hoping to really accelerate that process with. And last but not least, I could not be here with the sustainability theme without being able to share some of our progress in terms of how we've been thinking about measuring carbon. I think for us, what we've learned more than anything else, and some of the innovations in this morning's session, I think, reinforce this, is that it's not easy to measure scope 3. And so our focus more than anything else has been scope 4. Don't buy what you don't need. There's a direct cost benefit and there's obviously an immediate carbon benefit. And conversely, make sure you have what you need. And so don't run out of products. So while that's been our bigger focus, we have been able to implement in our dashboards the ability for our users to understand how their carbon relates to their peers. And we've been using basically the same EPA standards in our calculations to be able to provide that level of guidance. So there's nothing proprietary to how we're looking at the sustainability metrics, but we thought it was an important component to just start completing our solution. And none of this would be possible without our team. I guess I'll highlight, just because we are at stages and there's a Shark Tank, that we were able to add a really important investment group to the table, led by Tamarind Hill. So Mark Sherry joined our board. He's a founder first, serial entrepreneur, founded healthcare.com and a number of other wonderful initiatives. And since Mark joined our board, we also were able to bring on a number of new advisors that represent supply chain, clinical leadership, finance. And so I think we're pretty well represented. I have another exciting advisor that has helped us to open a major door that I'm excited to add to this slide. And so I think the team is ultimately what's allowed us to have this fantastic traction. And certainly telling them that we won the Shark Tank last year when we were competing with some really cool toys for surgeons really helped. So thank you very much. Thanks for having me back. And excited to see what choice you made with the very incredible innovations that you saw today.